Here I welcome you all on my next lecture, that is Glaucoma Part 1, including the information regarding definition, anatomical view, causes, risk factors and types of glaucoma. So moving towards first point, glaucoma, it is a Greek word meaning clouded or swollen cornea. It is a disease condition in which optic nerve damage is there, which can lead to cause visual disturbances. So this damage to the optic nerve is mainly caused due to rising of intraocular pressure, which is dependent on the balance between production and removal of aqueous humor. The normal range of intraocular pressure is between 10 to 21 mm of Hg, and if it is rising beyond this range, it is considered as abnormal state. Here is the anatomical view about the eye. So it includes two parts, that is the anterior part and the posterior part. Anterior part includes cornea, pupil, lens, iris, zonules and ciliary body. And posterior part is including sclera, choroid, macula, optic disc, retina and other parts. So this our posterior part is also called as vitreous body part. In anterior chamber, there is production of aqueous humor at this site, and this aqueous fluid will flow in front of this iris region, and it is drained by the trabecular meshwork which is situated over here. But due to some abnormality, this produced aqueous humor is not being drained properly, and that's why it gets accumulated in this anterior region. Due to accumulation, it exerts severe pressure on the anterior part and again can close the angle between iris and the cornea. So due to rising of this pressure, it can exert a pressure on the posterior part also. So due to this, there is excessive stress occurring on the optic nerve. Optic nerve is the bundle of nerve fiber which carries visual information from retinas to the brain. The rising of intraocular pressure is occurring due to the excessive aqueous humor production or the resistance developed to the aqueous humor passage. There are various factors that are affecting intraocular pressure, so you can pause the video and can dictate that. Next, the causes of glaucoma. The produced aqueous humor, if it is not being drained properly, then it can lead to produce glaucomatous conditions because of optic nerve damages due to the pressure which is exerting on the inner region of the eye. The risk factors associated with the glaucoma patient, that is the first is genetic cause, the next that is the race. So the African American peoples are 5 times having higher risks of production of glaucoma as compared to others. As the age is rising, the risk of producing optic nerve damage as well as glaucomatous state is also increasing. In diabetes, there is microvascular complication which can lead to cause retinopathy or optic neuropathy and can lead to further glaucomatous state. In cardiovascular diseases, there is excessive vascular pressure which can damage the retina and it can lead to cause glaucoma. In the patients with migraine, there is production of vasospastic condition. Again, they can damage the optic nerve. In the patient with nearsightedness, this condition, that is myopia, is developing due to the ray reflection which are occurring from the retina in front of retina, and they are not proper, and that's why person is able to visualize just the nearby objects, and due to that there is excessive strain which is occurring on the eyeball region and as well as on the optic nerve region. So due to that, glaucoma can be there. Again, The internal causes such as eye trauma can exert a stress on the retina. The long-term utilization of corticosteroids lead to cause rising of perfusion and can build intraocular pressure. Again, they can lead to cause glaucoma. Next, here are some types which are mentioned as per the different classification systems, like by the traditional way and modern way of classification. In traditional way, as per the etiology, they are considered as primary and secondary glaucoma. As per the anatomical view, it is also called as open angle and closed angle glaucoma, and that we have to study in detail. As per the age of onset, there are again of different types like infantile, juvenile and adult onset glaucoma. As per the causative mechanism, there are of two types, that is congenital and acquired. Again, by the modern classification system, there are three types of glaucoma. First, that is primary open angle glaucoma, primary congenital glaucoma and primary angle closure glaucoma. So, here I mention the basic difference between the open and closed angle glaucoma. Here we can see here is the lens region and trabecular meshwork. If due to some abnormality the aqueous humor production is rising and trabecular meshwork function is getting minimized, there is building of the aqueous humor at this region, and which can exert excessive pressure and can lead to cause open angle glaucoma. The condition is called as open angle because the angle between iris and cornea is open. And in the next state, due to some abnormality like the lens dislocation or iris dislocation, the angle between iris and cornea gets minimized or getting closed, and due to that the aqueous humor cannot drain properly, and that's why there is rising of intraocular pressure and can lead to cause glaucomatous state, which is also called as closed angle glaucoma. So here were some points, and we have to study the different points like pathogenesis, clinical presentations, diagnosis, etc. in the next part. Thanks for watching.